into therapeutics as well as nutritionals. We belong to the nutritionals. The difference between therapeutics and the nutri is that when we talk about nutri, it encompasses a lot of things. Yung mechanism niya po is not a tawag mo nun, something that's curative, ika nga. That's why it's called supplementation. When we talk about therapeutics, yun, iba yun. They have a mechanism of action that is intended to arrest the process of injury or the process of disease. Okay? That's why you have antibiotics. These are therapeutics. Ano ba yung ginagawa sa antibiotics? Magkasakit ka, lagnat, infection, umiinom ka ng antibiotics. First question, is the antibiotic, is it the one that made you well or not? It's your body. Ang ginawa lang sa antibiotic, pinatay niya yung mikrobyo para yung katawan mo will be able to fight off the infection. Next, antihypertensives. May mga processes in our body that could be wrong, hence, doon siya nag-a-act. No? So, that's how therapeutics are. Hence, pag tinatanong ka regarding treatment, using USANA products, stay away from making a general statement saying it cures. It has helped. Yes. It has helped in the management of these patients. Our doctor friends who talked with us have had good results with this one. But I did not say na yun lang yung binigay ko, di ba? Add-on siya sa mga binibigay ko. And that is the most important thing there. Because once you say it cures, dalawang things mangyayari. First, tatanungin ka, yan lang ba binibigay? Or, these people that you talk with may be lulled into a false sense of security and they would say, hindi ko na iinumin kong tong maintenance ko kasi ang galing pala ng essentials. And after 6 months, babalikan ka. Bakit tumaas ulit yung blood pressure or napasok na sa hospital? The reason why I espouse the use of supplementation is because it helps decrease the dependence for this therapeutics, for this maintenance medications. A decreased dependence that does not mean to say hindi na nila kailangan. Okay? Yay! Now, as far as reset is concerned and transform, question, how many of you have tried that? Nutri-Mill. How many of you lost weight significantly? Okay. How many of you tried that on patients who cannot exercise? Okay. Good. The greatest statement I have with Reset and Transform are patients with neurologic deficits. Meaning they cannot move about because they are paralyzed, half of their body, or they cannot really be functional because it is weak. A lot of these patients of mine, the younger ones are obese kasi. Okay? The age of stroke patients before, when I was in training, the youngest one na inopera namin was 28. Right now, early teens. Early teens. And may basis din yun. Kasi if we talk about cholesterol deposits in the blood vessels as early as 12 to 16 years old, meron na po. And that is the reason why we should extend the utilization of even essentials as supplementations for the young ones. Again, to protect them. Not to cure, not to reverse, but protect. Okay? Now, I have several of these patients, but I love this one. I have a 37-year-old female whose left side of the brain, yung kagaya kanina na infarcted. No? She can, swerte lang siya, she can talk, pero initially, pag kinausap mo, it's either disarted, just learned masyado, or kung may lumalabas, hindi naman tumutugma. Consistent, but she cannot walk. She cannot move the right half of her body, and she was so big. What I did initially was just prodded her to go on diet, meaning the oatmeal diet. Who loves oatmeal here? I do. 6 weeks after oatmeal, ayaw na niyang kumain ng oatmeal. Hindi pa rin siya kumayat. Yung wheelchair niya, tama para sa kanya. As in, hindi mo pwedeng pasukan ng kamay. Kasi eksakto. So I told her, okay, I have something here that might help you. I placed her on reset. But I did something with reset. Hindi yung sinabi nila, being a, yes, not a program. Not just the program. I added coquinol. Bakit? Why? What about the muscles? Malapit ka na. Malapit na. Why?
Sa mga para hindi ano.
And what happens if you require higher energy levels? Remember, hindi siya nakakalakad. Why would you need something na hindi mo mayu-utilize? It's an energy source, but you don't utilize it. Hindi naman, naka-wheelchair naman siya, may tumutulak sa kanya.
Ano yan?
Okay, it increases metabolism as an energy source also. No? By adding up to increase the metabolism, even if wala siyang masyadong exertion, the body is metabolizing. Kaya it adds. And yung mga pinakita na, ang dami na kasing testimonial, the pictures, ganon, di ba? Stretchable. Yung stretchable pants, stretchable na ano. But this one, these are patients who can barely move. They have to be carried left and right, up, down. And yet, when I gave her that after 6 days, I extend reset pala instead of 5 to 6 for my patients. Again, they are not the type of patients whom you would say mag-walking ka 30 minutes a day. Kawawa naman yun. Magtutulak sa wheelchair, di ba?
Yun ang papaya.
Yeah, yung nagtutulak yung nag-exercise, hindi yung patient. So, walang 10,000 steps yun. Buti na lang yung siguro finger walking, no? And yet, by the addition of that, what I saw is a patient who not only, whose weight did not just decrease, but rather, pati yung heft nila. Meaning, the dimensions. And after 15 days, mas lumiit siya. Of course, lilit talaga siya. Diba? Lumiit na nga after 6 days. What more than 15 days? May patient nga ako that his genes, he's 44 years old, he had a stroke, very active before that, but he was so big, he's like twice my size. To the point that when he visited me again after 15 days, yung jeans niya na niretire niya for 8 years, yun yung sinuot niya. Actually, then, ano pa ako tawag mo nun, I challenge age. I have a 76-year-old patient who is still on Transform up to now. Kasi gusto niyo magpasaksi.